In this section we will look at the skeleton, the framework of the human body. It gives us not only our shape, but supports and facilitates many physiological processes, including blood movement and production. All the additional information you need can be found in Unit 1, Section 3 of your manual. The skeletal system comprises two key substances, bone and cartilage. The first you're probably more familiar with. Bone is a type of calcified connective tissue and is the main component of a fully grown skeleton. There are around 206 bones in the human body, give or take. Some people have the odd extra one and some one less. This does not matter in a functional way. These bones connect at joints, which we will look at in detail in your next lecture. The second substance, cartilage, is a tough and fibrous connective tissue which is able to withstand large compressive forces. In the fetus, bones start as a cartilaginous model before they calcify and become hard. That said, there are 3 types of cartilage found in the adult skeleton. They all consist of differing amounts of collagen, tough fibrous proteins, and elastin, elastic fibres that give stretch and reflex properties. The ratio of these substances determines the function. There are 3 main types. The first is hyaline cartilage. This is the type found in the fetus, which is the basis of the skeleton. It is also found at the end of the long bones of the skeleton, where it acts as a shock absorber and prevents friction. In order to fulfill this role, it has a very high density of collagen fibres. Fibrocartilage is found predominantly in the intervertebral discs and menisci. It is tough and very strong by account of collagen fibres, preventing friction and absorbing shock. Elastic cartilage is found in structures such as your ears. It contains more elastin fibres, meaning that it is able to rebound to its original shape. Each bone in the skeleton is crucial for muscle attachment and can be shown clearly on Bob.
So in this video we are going to look at the bones of the skeleton, and we're going to do that with the help of my friend Bob here. So we'll start at the top and work all the way down to the bottom. The first bone we're going to come to then is the bones of the head. Now this is a series of fused bones that we'll often call the skull. Their correct term, however, is the cranium. So what we're looking at here is the cranium. As we come down again, you see these bones along the front here. Now this is commonly referred to as the collarbone, but more correctly termed the clavicle. Down the front in the middle here is a lovely broad, longer bone, and this is the sternum. Now that provides sort of protection at the chest and allows the ribs here to attach in, more commonly referred to perhaps as the chest bone or breastbone. As I mentioned, you can then see coming into that sternum all these structures here. Now these are the ribs. Now they're there to protect the chest cavity, and they come around and insert in here. So as we spin Bob round, give him a little pirouette, what we can then see on the back is how the ribs then come in and join onto the vertebral column. Now this is a long series of bones, all fused and joined up at cartilaginous junctions. We'll look at them in a little bit more detail later on. They're very different series of structures, different sections, which will break down a little bit more further. So it's the vertebral column, more commonly referred to as the spinal column. Here then is this lovely triangular bone. Now this is typically referred to as your shoulder blade, so a nice pointy blade type bone. Its correct name, however, is your scapula. Often quite a lot of problems around here, so really useful, really good site of muscle attachment as well. We'll spin Bob back around, and that means we can then have a really good look at his arm. So if I take his arm away here, so this bone along here, the bone of the upper arm, it's called the humerus, not because it's funny, just because that is its name. So what we then have as we move into the lower arm, I'll pop it on my arm here so you can see sort of how it would sit in reality. You can see 2 bones of the forearm. Now one that goes along to the thumb, we call the radius, and this bone here that sits along the bottom side goes to your little finger, we call the ulna. Now if you were to shake somebody's hand, the ulna would be underneath, so U for underneath, U for ulna, underneath as you shake someone's hand. So really useful for remembering which one's which. So we have the radius to the thumb and the ulna underneath. Moving then into the hand, so you can see all these little cuboid bones in the wrist. Now these are the carpals. And then below there, that make up the body of the hand, you see these slightly longer bones, and these are called the metacarpals. Again, we've then got a series of sort of smaller bones into the fingers that allow it to bend, and these are called your phalanges. So really useful, lots of bones that make up the hand, all that allow that degree of movement you've got. So then we come to the hips. Now the hips are a series of fused bones. So on each side they're symmetrical, right? So the top two bones here, now this is the two ilium. So we have an iliac crest that sits along the top, and then underneath you can see these sort of really irregular shaped bones down here. Those are the two ischiums. Now they'll be your seat bones, so when you sort of sit down you will feel your ischium on the chair. Again, you've got the pubis at the front, so those bones all fuse together to make up the hip or the pelvis. What we can then do is have a little look at Bob's legs. So the bone of the thigh, the upper leg, this is the longest bone in the body, and it's called the femur. So really good, articulates from the hip all the way down to your knee. Hopefully what you can then see is this lovely little round type sort of seed-shaped bone that sits across this knee joint. Now that's actually a sesamoid bone, or commonly known as your kneecap, and its correct name is the patella. So we'll look at that a little bit more later on, how that makes it special. Coming into the lower leg then, you can see similar to the forearm, you have two bones. You have the tibia that sits along the top, and that'll be the bone that you sort of feel as you run your hand down the shin bone effectively, and then the fibula, which sits down the outside. Both of those run down either side of your lower leg and create the knobbly bits on your ankle, which we call the malleolus. So the one on the inside is your tibia, and the outside is the fibula, the end of the fibula. So those are the two bones there. So T for tibia on top is a really useful way to remember which bone we're looking at. That then leads us nicely down into the foot. So similar structure to the hand, but these sort of cuboid bones here we call tarsals. So you have toes on your foot, so therefore T for toes, T for tarsals. So really, again, useful tools to try and remember which one's which. Again, the longer bones then in the sort of body of the foot we would call metatarsals. And then once we're into your toes, all these little bones, similar to the hand, called the phalanges. So that's the main bones of the skeleton with the help of Bob, and we can then move on to look at what they do.
We are able to classify the skeleton into two main parts, the axial and appendicular skeleton. The axial, or centre part, contains all the bones that create the main axis of the skeleton. These include the spine, ribs, sternum and cranium. All the limbs are part of the appendicular skeleton. The spine is a series of bones worth looking at in more detail. Made up of a series of irregular bones called vertebrae, it creates an interlocking system, allowing movement, providing muscle attachment and protection of the spinal cord. Each vertebrae has a channel within it, allowing the crucial spinal nerve to run the full length of the back, providing sensation to the whole body.
So in this video, we're going to have a little bit more of a detailed look at Bob's spine. So each vertebrae, as they run up and down, are connected at a cartilaginous junction, and we call this the intervertebral disc. So between every single vertebrae, there's a disc. Really worth noting as they can often be damaged. Each vertebrae then has a pretty similar structure. You have a primary sort of body, which you can see as you look through from the front here. And as I then spin Bob around, you can see there's all sorts of sort of pointy structures on each vertebrae. So on the sides, you have two transverse processes, so left and right. And then down the back, which you can feel if you run your hand down somebody's spine, you can see what we call the spinous processes. Now these are really useful for muscle attachment as well as sort of maintaining movement. Now when we look at the spine, we split it up into a series of sections. So we'll work through from top to bottom. Now the first 7 vertebrae are the cervical vertebrae, and these are the ones of your neck. Now they have a lot of movement, but they also are specialised in that they have a gap in the transverse process for the vertebral artery to run through. Now this is really important because it provides extra protection for blood vessels within your neck. So that's the first 7 vertebrae. Now the top 2, so what we would call C1 and C2, also are called the atlas and axis bone. Now that is because C1 is able to pivot around C2, and it allows you to pivot your head and turn your head, so there's much more movement at C1 and C2 than the rest of the vertebrae. So that's a really, really important adaptation. The next set of vertebrae are the 12 thoracic vertebrae, and they relate to your ribs. So a pair of ribs attach to each thoracic vertebrae. So as we move down the spine, each vertebrae below has relatively less movement than the one above. So the upper thoracic are going to have more movement than the lower thoracic in terms of rotation. Once we come to below the rib cage, we're looking at the lower back. The vertebrae of the lower back are called the lumbar vertebrae, and there are 5 of these. Again, less movement than the ones above, and often you'll have quite a few problems, lower back pain, can often see disc troubles in the lower back as well. So it's an area to be really aware of when you're massaging. Below this then, the next section you can see is the sacrum. Now this is another series of 5 vertebrae, but they're fused. So they're all joined together, there's no disc between. Now, again, you can see nicely spinal nerves coming from this section, and they will articulate. They have very little movement in that section. Below that, in the last section of the spine, is the coccyx. Now, if you've ever bashed your coccyx, you know it's quite a painful area, quite a lot of coccygeal nerves down there. But it would have been your tail, which we no longer need. So there are 4 vertebrae there, all fused together. So from top to bottom then, just as a sort of recap, so we've got 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar, 5 sacral, and 4 coccygeal. So I always remember 7, 12, 5, 5, 4. And then cute teddies love some cuddles for cervical, thoracic, lumbar, sacral, coccygeal. Now another area that's just really important to note when we're looking at the spine, especially at the sacrum, is the sacrum's articulation with the ilium, so the top bone of your hip. This provides the sacroiliac joint, or the SI joint. Now there is movement in this area, but relatively little, but it's a really important joint to maintain its mobilisation and can be an area that people present problems with. So just be aware of it when you're massaging and looking at these skeletal structures. So hopefully that gives you a nice overview of the spine, its structure and the key areas, but that will then mean we can move on and look at the muscles that hopefully attach to it.
So what are all these bones for? Their primary function is to give the body its basic shape. It will determine someone's basic body type. Are they tall and lean, an ectomorph, shorter and more rounded, an endomorph, or athletic and muscular, a mesomorph? These body types are also influenced by muscle and fat. Bones are crucial for protecting the body's internal organs from external impact. The ribs protect the heart and lungs, for example. The skeleton also provides a framework for muscle attachment, allowing movement, with the bones acting as levers during activity. Less obvious functions of the skeleton are storage and production. The bones in your body produce both red and white blood cells, stem cells, as well as platelets from within the bone marrow. This is crucial for body functions and regeneration. They act as a sink for calcium and other nutrients, storing them until they are required by the body. We are able to classify bones by their shape. Most bones are long bones, and these are typically subject to the largest forces in the body. These bones are longer than they are wide. They have a main shaft, the diaphysis, with 2 lumps at either end, the epiphysis. Between these are the epiphyseal or growth plates, which allow growth of the bone as the diaphysis essentially becomes longer, stimulated by the release of growth hormone. Bones such as these include the femur, radius, and phalanges. They consist of hard or compact bone, with cancellous or spongy bone in the epiphyses. The cancellous bone looks like a sponge and has air pockets within. This makes the bone compact, strong, but also very light, particularly relevant for birds, as most of their bones fall into this category, enabling them to fly. These bones have an excellent blood supply, which is crucial for the deposition and mobilisation of minerals such as calcium, but also for repair. In addition, the ends of long bones are covered in hyaline cartilage, which will help absorb shock and prevent bone-on-bone friction. The outermost lining of the bone, and this applies to all bone types, is the periosteum, and it is from this layer that fascia and tendons are able to fuse, and therefore explains how muscles attach to bones. Further to these there are short bones. These include the carpals and all bones that are typically cuboid or squarish in nature. They are normally highly cancellous, giving strength with low weight. Flat bones such as the scapula, sternum and ribs are exactly as described. Flat. They consist of a layer of cancellous bone sandwiched between two layers of compact bone. These bones are particularly good for muscle attachment as they provide large flat surfaces. The vertebra and calcaneus or heel bone can be described as irregular bones. They have no clear structure and therefore don't fit into the other groups. The final type is the sesamoid bone. The kneecap is the best example of this, although they can also be found in the foot and hand. It is seed-shaped and sits within a tendon, in this case the quadriceps tendon. This allows it to provide protection while facilitating movement, as it helps to keep the quadriceps in line. Bone formation is a surprisingly simple process. In essence, there are two types of cell involved in bone development: osteoblasts, these help build bone, blasts build, and osteoclasts, these clear away old bone, clasts clear. The osteoblasts are particularly useful, as when they fatigue, they in fact become part of the bone, as a structure called osteocytes. Although dense and hard due to the amazing blood supply, nerves and active cells, bones are living tissues, and they will continue to remodel and adapt throughout our entire lives. The bone growth process is referred to as ossification, meaning the laying down of calcium, minerals and salts to create the bone. We can look at this more particularly over a lifetime. In the fetus, bones start out primarily as a cartilaginous model. As blood vessels start to develop, osteoblasts and osteoclasts get to work, depositing calcium and minerals to replace the cartilage cells. This process is referred to as endochondral formation. Flat bones develop in a similar way, except that they originate from a membranous structure, and the process is referred to as intramembranous bone formation. Ossification initially progresses in a haphazard fashion, and bone is laid down in an irregular way. We call this woven bone. Once woven bone is formed, the osteocells will immediately start to organise the structure, laying it down in an orderly fashion, making the bone stronger. This is then lamellar bone. This process continues during youth, starting in the middle of the long bones, the diaphysis, which start to develop a good blood supply, increasing the ease of nutrient deposition. This allows growth to happen at the epiphyseal plates, located between the diaphysis and the epiphysis. Bone remodelling will continue long term as a result of stress and damage. Bones do bend a little, but if they are bent outside of their normal range, they will fracture, hence the need for the remodelling process. Bone fractures heal under much the same process. However, they start under a different mechanism. As damage to a bone occurs, the blood vessels will also be damaged, meaning that the area starts to bleed. Therefore, a clot will form, helping to fix the bone in place short term. The local blood vessels will then constrict, causing localised cell death. Sounds bad, but these dying cells trigger the release of a hormone called cytokines. This acts as an inflammatory marker for the osteocells, causing them to flock to the area and begin the healing process, clearing the damaged area before laying down cartilage and granulation tissue to create a lump, which we call a soft callus. This is then remodelled with the laying down of woven bone, which is further replaced by lamellar bone. This leaves a hard lump, a hard callus, that will normally stay distended beyond the bone surface. In ageing, bone remodelling is particularly relevant, and therefore important for you as a massage therapist. As you age, in fact from around age 30, your bone density will start to decrease, often leading to a condition called osteoporosis or brittle bones in later life. You must consider this when working with older clients, as they potentially have weaker bones, although this is not always the case. Other at-risk populations might include female athletes with poor nutritional intake, or those with a particularly sedentary lifestyle. Some decrease in bone density is inevitable with ageing, but the rate of decline can be controlled. Through impact exercise, the rate of this decline can be managed. The best effects will be seen in those who undertake such exercise from a younger age. However, the decline can be slowed, even if not halted, by starting exercise at any point. This is worth noting with at-risk clients. You have now covered the skeletal system. You can now move on to complete the tasks and your worksheet. The next topic will introduce joints, and therefore the way the body moves.